Within weeks of opening her medical clinic, Dr. Kathleen Holland had 7 infants who stopped breathing and had seizures severe enough to require emergency resuscitation in her office, considerably more than what most pediatricians see in an entire year. When one of the children died, local health officials demanded answers. Kerrville, Texas is a quiet little community just an hour's drive from San Antonio. Although Kerrville is primarily a retirement community, Dr. Kathleen Holland saw a business opportunity. She opened what was only the 2nd pediatric clinic in Kerrville. Reed and Patty McClellan were excited by the prospect of a female pediatrician coming to town.
A lot of mothers do want to take their kids, particularly if it's a girl, to a female doctor. And this was a young doctor, progressive doctor, somebody that seemed to kind of breathe a little bit of fresh air into the medical community there and had training in the latest techniques.
The McClellan's daughter, Chelsea. On the way, Chelsea went into cardiac arrest. The ambulance pulled off the road so Dr. Holland could assist in the resuscitation.
I jumped into the ambulance and started doing CPR and asked them where the closest facility was, which was Comfort. And so we pulled into the closest facility. And unfortunately, she did not respond to all of the efforts to bring her back. And so after about 20 minutes or more in the hospital, as well as all of the efforts en route, she was pronounced dead.
The autopsy concluded that Chelsea died of cardiac arrest attributed to sudden infant death syndrome, which usually occurs in children under 1 year of age.
Chelsea had been premature and had some breathing problems at birth. But by all accounts, medical accounts, she had outgrown that problem. And SIDS is something that afflicts kids who are younger. I mean, certainly doctors can speak about that more authoritatively, but generally you don't have kids dying of SIDS at the age of 15 months.
Over the next several weeks, Dr. Holland had more emergencies. A 5-month-old girl started choking and was unable to breathe, and she too had to be rushed to the hospital. A few days later, yet another child had a seizure which required emergency treatment in her practice. One of the doctors suspected some type of muscle relaxant like succinylcholine had been injected into one of Dr. Holland's patients before arrival at the hospital. Succinylcholine is a powerful muscle relaxant which can cause respiratory failure in large doses. It's so powerful, it's sometimes used in lethal injections for executions. Dr. Holland said she had a vial in her office but had never used it.
Never used it.
They also asked Dr. Holland if she trusted her employees.
Yes,
Dr. Holland said she did. That night, after office hours, Dr. Holland spoke with her nurse, Janine Jones. Dr. Holland described Jones's behavior that night as suspicious.
There was a lull in the conversation, and the next thing she said was, "Oh, by the way, I found that missing vial of succinylcholine." And I said, "What missing vial of succinylcholine?"
I told you before. I lost a vial of succinylcholine and ordered a replacement for it. And I found the missing bottle, so now we have 2 vials.
Dr. Holland suspected it was more than a mere coincidence that her nurse mentioned the exact same drug doctors asked her about in the meeting.
And I'm just sitting there, and I'm absorbing all of this. And I'm putting it in perspective with the meeting regarding my emergencies.
The next morning, Dr. Holland went to the refrigerator and found the 2 vials of succinylcholine. Both appeared to be full, but in one of the caps, she noticed 2 tiny needle marks.
And at that point in time, my whole world collapsed. And I remember being emotionally just in turmoil that morning, just absolutely in turmoil.
Dr. Holland immediately turned the vials over to the authorities.
Dr. Holland was within our circle of suspicion. Dr. Holland was very defensive in our investigation.
While all this was going on in Kerrville, there were similar suspicions about Janine Jones in San Antonio. Just 1 year earlier, death rates rose dramatically in the pediatric intensive care unit at Bexar County Hospital while Janine Jones was working there. Dr. Vincent DeMaio, the chief medical examiner for Bexar County, heard suspicions about Janine Jones from some of his medical colleagues.
After a while, it became common knowledge, and it became a kind of a morbid joke that if you were going to have deaths in the pediatric care unit, it was always on the shift that Janine Jones was working.
Dr. DeMaio passed this information on to Deputy District Attorney Nick Rothy, who discovered that the death rates dropped as soon as Janine Jones left the hospital.
We could tell that when Jones left, those peak numbers dropped immediately. The month she left, the day after she left, things just leveled out and stayed level. They were level going in and then just peaked right there. And then the minute...
Aides, ward clerks, therapists, technicians, and medical residents. Dr. Istri began his investigation by assigning each employee a number. He charted which of the 200 individuals were on duty at the time of the 30 suspicious deaths and the 50 or so unexplained medical emergencies.
Nurse 32 had a significant and quite extraordinarily high risk of deaths to patients when Nurse 32 was working compared to when Nurse 32 was not working. In fact, that risk was 10 times higher. The risk of death was 10 times higher when she was working compared to when she was not working.
And the identity of nurse number 32?
Nurse 32 was Janine Jones, is Janine Jones.
Prosecutors found evidence that supervisors in the intensive care unit strongly suspected Janine Jones was somehow involved in these mysterious deaths, rather than with the child when she first experienced seizures, and she was with her in the ambulance when she went into cardiac arrest and died. A vial of succinylcholine was missing from Dr. Holland's office, then later resurfaced filled with water. But prosecutors had no way to prove the drug caused Chelsea McClellan's death, since there were no tests available to find it in human tissue. But prosecutors heard about a forensic scientist in Philadelphia, Dr. Frederick Reeders, who was conducting research on drugs like succinylcholine. Chelsea McClellan's autopsy samples were sent to Dr. Reeders, who took them to the Karolinska Institute in Sweden. There, an experimental protocol permitted Chelsea's tissues to be analyzed with gas chromatography. This process, San Antonio, specifically for injecting an infant with 22,000 units of heparin, a near fatal dose. For that crime, Janine Jones was sentenced to an additional 60 years in prison.
What had happened, what Janine was doing was injecting these children with a drug called heparin, and which is a blood thinner. And because it's a blood thinner, these children's little wounds wouldn't coagulate. And consequently, they started oozing blood from all these stick marks.
Janine Jones began creating havoc in the intensive care unit in San Antonio because of what prosecutors believe was her contempt for some of the doctors and registered nurses who worked there.
But she was still an LVN. She didn't have the education they had, and she wasn't going to go as far as they were going to go. And I think she resented that.
And when Janine Jones left San Antonio, she continued.
That I wasn't going to quit, and I wasn't going to leave. I had nothing to run from.